My asthma. They said they'd fix it, but it didn't make any difference at all.
Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Okay, now that we've all had our aha moment by viewing the Dr. House video, we're going to talk more about the in-check dial. My name is John Silva. I'm with Alliance Tech Medical. Our company is located in Texas. Now let's move on to the dial. The in-check dial was designed to help the patient know how to use their meter dose and powder dose inhalers. It's a training device. We're training inspiratory rates viewed in liters per minute scored on the dial here. If you'll notice on top of the dial, the different icons, which represent, once again, the different devices. First of all, we want to start with the laminar flow or the no resistance, the wavy lines. You want to turn the dial till we line up the no resistance mode with the arrow. The optimal flow rates are in liters per minute, and the different ranges are packaged with the insert per medicine by design from their FDA submissions. What we want to do is take a one-way valve inspiratory mouthpiece, and what that means is there's a valve in it, and the patient can breathe in, but you cannot breathe out if it's placed in the right position. So with the arrows toward the patient and the dial set at the no resistance mode, we want to tap it, which moves the magnet to reset the red cursor, and then we tip it to set the magnet back to the top side, and have the patient just breathe in normally. Now what we've done there, we've established a baseline in liters per minute. Obviously some patients are going to breathe in better than others, but we want to find out how they're doing right now while they're sitting down in front of you. And say they're using currently, and have been for a long time, the discus. So we want to turn the dial to the discus, line it up with the arrow, tap it, turn it, have the patient breathe in just like they were at home taking their medicine. I was a little bit heavy with my numbers, so I want to slow down a little bit. It's a little better. But if you notice at the first with these powders, you want to breathe in with a little more force at first and then kind of plateau out, because that first millisecond is really important to get that powder out of the device and started to the right placement in the lung. Now, a lot of people will just grab it and go, which is totally wrong, because what they're doing, they're just impacting their pharynx and swallowing the majority of the medicine. Same way with the propelled agent. Propelled agents that's what it is, they're propelled. They have an energy force behind them. So the patient needs to slow down and just maybe feel like a feather going across their lips. That kind of a breath, not real tough and strong. I know that sounds contrary to what people are doing, but it is the proper way to use these. So once again, you do a cleansing breath. If you'll notice, I was just a little bit strong on my inspiratory effort there. I'm at the top part of the graph. Ideally, you want to be middle to upper 2/3. It's okay if they're a little bit stronger, but you want to just stay in the upper 2/3 of the flow, of the optimal flow range here. Traditionally, I'm going to demonstrate how most people use their devices from the PDI here, the powder dose inhaler. That particular one is the discus, obviously. So tap it, reset, turn. Now that's an improper way to do it. Okay, so you got to slow them down. Remember that first millisecond blast, then you want to plateau out. That's the more proper way to do this. Okay, with the discus. Okay, that's going to get more or less guarantee you the more proper infiltration of the lung with the medicine and get a better deposition there. Now, once again, I'm going to digress a little bit, and we're going to go back to the propelled agent. Once again, you want to slow them way down. You want to select the agent, line it up with the arrow, or the device, I mean, not agent. Tap it, turn it, and just breathe in gently. But typically, this is what patients do. Cleansing breath. And that's just not correct. And their treatment plan is not going to be as good as it should be. Now, for smallmouth adults or pediatrics, we do have a little smallmouth adapter which will fit on top of the mouthpiece, the disposable one-way valve mouthpiece. Once again, pediatrics, someone with TMJ, just a small mouth adult. This is a 4-adil adapter, and what you want to especially remember to do when you're using the in-check dial here, put it in place, rotate the dial around once again to the no resistance position because we don't want double jeopardy here. And then we grab the mouthpiece, arrow, inspiratory flow, tap it, turn it. Now the patient breathe in appropriately. We also have one for Spiriva, the HandiHaler, and they are scored on the inside, the HH for the HandiHaler and an F stamp for the 4-adil. With the new meds, we only have so much room on the dial, so rather than reinvent it, we just make these adapters. The most economical way to purchase the dial is with the kit. You get 200 mouthpieces, a training CD, the dial itself, and the 2 adapters. When we talk about multiple patient use, we got to immediately think about cleaning. Now, we want to wipe off any organic debris that might be on it. Get a nice disinfectant solution. It does not have to have glutaraldehyde in it. Slosh it around, shake it real good, let it soak for 10 minutes, rinse it, and then let it air dry. Okay? And then between patients, you can wipe off the outside with any little clean pads that come pre-packed. Primarily, they have a lot of alcohol in them. It's not really good on the plastic, but it's kind of a must. You need to clean them on the outside between patients. There is a CPT code involved with this training. Once again, it is training with the in-check dial. The CPT code number is 94664, and occasionally you may have to use a modifier, and the modifier number is 25.